I'm Eleanor Rutter. I'm a public health doctor and a member of the public health team here in Sheffield. This is the second of 3 short videos on reducing the chance of infection with coronavirus and focusing particularly on how it's spread and how to stop the spread of the infection. So starting right from the very beginning, there are 2 ways in which coronavirus is spread. That's either by respiratory droplets or by what we call direct spread. Direct spread of coronavirus can happen if somebody coughs or sneezes onto their hand or onto a hard surface. Another person could touch that hard surface, say a door handle, or perhaps shake the hand of that first person, and then the virus can be transferred from one person to another. If that second person then subsequently touches their eyes, their nose or their mouth, they too can become infected. So it's quite easy to see that if we want to reduce the risk of infection to ourselves or any of the clients that we're working with, we need to break that chain of infection from one person's airways out onto their hands or other hard surfaces and then subsequently into somebody else's eyes, nose or mouth. As I said in video 1, that does not necessarily require high-tech solutions. Indeed, the most basic measures are actually the most effective measures. Now, in order of importance, i.e. the ones that are most impactful, these basic measures start with hand washing, respiratory hygiene, social distancing, and then only after those 3 measures do we start to think about PPE, which might be required in some specific circumstances that we'll come on to. If we start with hand washing, hands need to be washed regularly, more frequently than you normally would, with soap and hot water and for 20 seconds. This is far and away the most effective way of reducing spread of coronavirus through direct contact. Alcohol hand rubs, which need to be more than 60% alcohol, can also be used, but they're not as effective as hand washing with soap and hot water, and they mustn't be used if hands are visibly dirty. Whilst easier said than done, we should all also try and keep our hands away from our faces. Touching your eyes, nose or mouth gives a virus a chance to get into your body and for you to get infected. Respiratory hygiene. Now this is a fancy way of talking about coughs and sneezes. Most of us were brought up to sneeze into our hands and then we just ignored it. We'll also be aware of the phrase catch it, bin it, kill it. That's something we hear every flu season. Essentially what that means is that if you're going to cough or sneeze, try to do that into a tissue. If you cough or sneeze into a tissue, then dispose of that tissue immediately and then go and wash your hands. If you're not able to sneeze into a tissue, you don't have access to a tissue, you might also want to sneeze into your elbow. That is definitely better than sneezing into your hand, but either way, follow that by washing your hands again thoroughly for 20 seconds with hot water and soap. Moving on to social distancing, we're all becoming quite expert at social distancing these days. Of course, there are 2 particular types of social distancing. The first is where we should all be avoiding contact with anybody who has symptoms of coronavirus or members of their household. They should now be isolating so that they don't have contact with other members of the community. For the rest of us who aren't experiencing symptoms, we're all now comfortable with social distancing, which essentially means minimising the number of social contacts we have throughout the day. Many of us will be working from home or not working at all. We leave our homes only when we need to, and when we do go out, we need to be maintaining that 2-metre distance from other people. So those 3 basic measures are all described well in other places, and I'm not going to go into more detail in this video. The 4th step is the use of personal protective equipment or PPE. Now we've got to remember that PPE does not provide as much protection as the first 3 measures and should only be used really in addition to those, or there are some work scenarios where some of those basic measures might not be possible. PPE will only work if it's used properly. It can provide a false sense of security by making people feel safe. They tend not to adhere to the more basic hygiene measures, and therefore the risk of infection can actually increase. Given that PPE can, in some circumstances, actually increase the overall risk of infection, it should only ever be used by people who have been advised to do so and have been trained to use it properly. When to use PPE and what items of PPE are necessary is the subject of the next video number 3.